So I just, this really is more of a conversation, honestly, and I'm hopeful that it'll be helpful for the incoming interns, from across the country. We had a really great panel a couple of weeks ago, and if you don't know Isabel Silva, she's a medical student, a superstar medical student from Rutgers, who has been doing a lot of the Latino Plastic Surgery Society work, the social media work and planning and emailing. And we're working on some papers and thinking of ways to make this even more widely available. But it's crazy, right? We're working on something that hasn't existed, right? Despite plastic surgery existing for so long in the United States, there hasn't been a specific focus talking about Latino and Latina plastic surgeons. Is my video working? It seems like it's stuck for some reason. It is, it's working. Okay, good. And so the question, so it's been really great. And so we had some incoming interns talk, and I just, we planned on maybe doing something last year, right, when you guys had matched. But I still think this is a really important topic of, what is the intern year like, and how did it go, and how did you, what were some of the things that you expected to go well and did, and then those things that you just didn't expect. I thought it'd be good just to first start off, if you guys can kind of describe, where you're originally from, and a little bit about your story, and then how you ended up, you ended up at your program because you matched there, but how it's how you ended up in plastic surgery, and how it's been going, at least initially, and then we'll go over specific parts of the intern year.
Sure. I don't mind going first, if that's okay, Tyson.
Yeah.
So my name's Edie Perez Alvarez. My family is from Puerto Rico, and my grandparents are from Cuba. So I'm a mix of Puerto Rican and Cuban. I grew up in Florida, but spent most of my summers in Puerto Rico. So I was able to get involved in the culture, spend a lot of quality time with my grandparents, perfect my Spanish. And then when it came to figuring out college stuff, I wanted to venture out and kind of go off on my own and become more independent. So I ended up in Washington, D.C. for college at Georgetown. And luckily, Georgetown has a program where they kind of connect you straight through to medical school there. So I applied to that program, was accepted. So I stayed at Georgetown for medical school. And I actually, when I was in undergrad, I worked in a surgical waiting room part-time, mainly in the evenings to make a little extra money because DC is very expensive. But through that job, I started, getting early experience in the surgical field and got to see firsthand kind of what happens on the other side when surgeons interact with families and how families react after some smaller surgeries versus some incredibly large and long surgeries. And just, I think between that and my experience working as an EMT in college, I realized that medicine was definitely the route I wanted to go, and that I was a very hands-on person. I liked kind of immediate results, taking care of something and seeing a solution right after or soon after. And so typically that's kind of what aligns more with the surgical path. So when I went into medical school, my mentor was a female breast surgeon at Georgetown. And so I fell in love with breast surgery. I was like 100% breast surgery. I was going to do a surgical residency and then a breast fellowship. And our department is very closely intertwined with the plastics department, as you would expect from a research standpoint. So I slowly got to know the plastics department through that, but I never really thought, oh, I really want to do plastics until I did my third year clinical rotation. And I was already struggling because I loved my peds rotation. I actually really enjoyed my internal medicine rotation. I enjoyed my OB rotation. And once I got to plastics, I realized that a lot of the things that I didn't want to give up, like working with kids potentially, or working with a whole range of demographics, whether it's older people, younger people, kids, females, males, whatever you want to, you know, describe the patient populations that we see. And plastics is just so diverse compared with the breast oncology patient population, which is very specific. So that's kind of when I started to put my life into perspective and ask myself, what did I really want to get out of a career, especially in surgery? And my ideals seemed to align much better with plastics. And so then came the long journey of trying to get everything in a row to be able to be a competitive applicant, which thankfully I already had research from the breast surgery perspective, but other things such as like scores, papers, more networking in plastic surgery, I all kind of had to scramble with. And then COVID threw a little bit of a wrench in that. But it also helped us bring us together as a community, especially through the online and social media world, a lot closer. And so I was able to reach out to Dr. Galvez while I was going through the process and get some advice from him. And also had great mentors at Georgetown. Had a phenomenal array of programs that I interviewed at and could have chosen to go to. But Rush was an ideal option for me in my list of things, of places that I interviewed at, largely because I wanted to take care of a Hispanic population. I felt like, my gift of being able to speak two languages would just go to waste if I went to some of the other places that I interviewed at. I'm very interested in gender affirmation. And just in general, I wanted to have an extremely diverse set of experiences in residency, because who knows what I want to do, even though I think I wanted to do breast. I didn't know if I wanted to do gender affirmation. I didn't know if I wanted to do hand or craniofacial. And so I wanted to be able to say that I went to a program that I tried a little bit of everything. I wanted to do some trauma, which is not available at all programs. And so the Rush program rotates at the famous Cook County Hospital, where you see the all too notorious trauma from Chicago. So overall, I ended up at Rush because I matched here. I'm extremely happy. It's incredible. That's already been a year. Dr. Galvez probably feels like it went in the blink of an eye.
It did. Absolutely. That's what we were talking about earlier. It goes by so fast.
Yeah, but overall, I'm extremely happy. I've had an amazing experience, which I'm sure we'll get into a little bit more later, but that's kind of the story and the background about me.
Awesome. Thank you, Edie.
Hi, everyone. My name is Thais Calderon. I guess I hail from originally Lima, Peru. I was born there. All of my family is Peruvian, basically, and then it kind of trades down into this expected heritage, like Spaniards. But I lived there until I was 5, and then I came to the States with my family. So it was my mom, my dad, and my brother. And we kind of just settled in Silver Spring, Maryland, so right outside of DC. And I loved that area. It was incredibly diverse. It had such a strong Latino community. And growing up, my mom was a nanny, and I had the opportunity to shadow some physicians because they were the children, or at least the parents of the children my mom took care of. So I, like Edie, worked in a hospital. I worked in a pediatric ED in around the Wheaton area. And I was basically just a Spanish translator for all the physicians and nurses. And I thought that was a really good introduction to medicine and figuring out, what I liked and what I gravitated towards. I realized very early on, I gravitated towards procedures, but I also really liked working with kids. So coming in, I thought maybe I wanted to do something like pediatric emergency medicine or pediatrics. I ended up going to Amherst College because I was a Questbridge scholar, and that was one of our partner schools. And similar to Edie, I applied to the University of Rochester through an early acceptance program. So I interviewed as a sophomore in college, was accepted as a junior, and then had the opportunity to travel abroad, which I thought was just a really great gift to me. When I came to Rochester, I very much realized that my passions continued to align with Latino health. So I worked a lot in the migrant farm workers environment, very based on just primary care policy law. And I found that to be incredibly fulfilling. started to kind of dabble in the field of surgery, but I thought I wanted to go into general surgery and be a pediatric surgeon. So the majority of my research is actually in like pediatric trauma surgery and opioid recovery. And then in the middle of third year, I did a 6 weeks plastic surgery program experience. And I didn't think that I was going to love it as much as I did. And I didn't think I was going to miss it as much as I did. And I remember the chief resident at the time, Nick Wingate, pulled me aside and basically was like, hey, like, only do this if there's like absolutely nothing else in the world you want to do. Like, if I tell you can never go back into an operating room and you cry, like that's that, then you know you want to be here. And I thought like, oh, this dude's crazy. And then I finished my OBGYN rotation in the spring and realized that that was probably going to be the last moment I stepped into an OR if I hadn't like chosen surgery. And I actually kind of wanted to cry. And I found myself like finding ways to just sneak into ORs, like go see cases. And to me, that was kind of like the moment of like, okay, like, you know what you want to do. And you know where you want to be. And that kind of also scared me because I hadn't prepared myself for the process of applying into plastic surgery. I didn't have the research. I quickly got connected with the department and they were so incredibly welcoming. And COVID actually, I think, saved me. It gave me a big opportunity to network, to meet people across the country that identified with me and my story, but also had passions in Latino health and primarily within plastic surgery. It let me do research with different programs, and I thought that was incredibly helpful for my CV. When it came to the interview trail, I felt very fortunate, like Edie, with the opportunities I had and the programs I got to meet and kind of explore. Ultimately, I chose a path that was a little bit different. I wanted to really kind of bank on my base training. So find a program that was going to give me the volume and the breadth and depth so that one day when I do want to enter a primarily Latino community, I have all the tools and resources I need to go at it alone, but still have a funded and like abundant alumni network to support me through that process. So I felt very, very grateful to fall into the hands of UW. I think, you know, this year has been a phenomenal learning experience. It's gone super quick. Which is sometimes a little bit scary, but I think looking back, and I think Edie can agree, like we've grown so much, and it's really hard to like quantify that on a daily basis. But like looking back and knowing how to like manage acute patients or, you know, post-operative patients or work up pre-operative patients, that those all become skills that you start to acquire. And I'm really excited to see what the next year has for us.
That's awesome. Thank you guys both for sharing that. I think it's the reason during my residency, and this is why we're building this forum, you know, to hear your stories. I was just, you just put your head down, you work, you leave, you leave work, you go home and recover, you hang out with friends, and you don't really have that much time to do outreach, right? And that's what's so, like, just like you said, the opportunities you guys saw with COVID, whether it's research, whether it's networking, that's what's different now than before. We didn't have this technology. What was it, 2011 when I started to do, there wasn't webinars like this, right? Where you could set things up and have people have discussions. And so what ends up happening is you just end up working and moving forward and checking boxes. And I think that's what's so cool is we're able to listen to your stories now in like real time and hopefully inspire others, right, to consider it sooner, right? And it's not always, you're not always going to consider it sooner, right? Some of it is part of your story, right? Where whether you do breast surgery, whether you're interested in pediatric trauma surgery, and you eventually end up into plastic surgery. But I think those are the fundamental reasons of why there's this persistent difference and why it's so low is not only do we not get a good, sometimes it depends on what school you go to, it depends on what opportunities you have, but you have, it's not all the same. And so some of it, a good portion of it, as you guys have seen, is luck, right? And so you guys are really in this awesome, it's a privileged position, right? You go in as an intern, you're like, I'm just an intern, right? I'm at the bottom of the food pool and I'm literally just checking. I have a little checkbox and I have to check the box. and then I have to check the next box, and then I have to check the next box. And then later in the day, I have to restart that whole process and check boxes. But it's still, it's a privileged position. So I want to congratulate you both for, finishing the year, and you're moving on to, we were talking about that earlier, but you're moving on to being a consult resident, which is that much more exciting because you're going to be seeing people. You've done a little bit of consults, but you're going to see some more complexity. You're going to have to do like multiple things at a time, managing your time. And then you're going to be doing cases. You're going to be like a first assist in a breast reconstruction case, right? That's like Edie, that was your dream before, right? That's what you wanted to do. You're going to be doing that this year. That's really exciting. And then talking to the family after about what happened and following them and talking to them in Spanish if they're Latino, and connecting in ways that others may not be able to connect as well. And so that's why I think it's exciting. And this year is, that's how you're learning what type of doctor you are, right? How different you are compared to others. Whether it's you're just checking boxes or you're spending the time to make sure that the family really understands the post-operative instructions so they're doing well, or really understands when something goes wrong so they feel comfortable. And so that's the rewarding part, as you guys know. And so I think at least, we have several of the students that we're presenting, that are starting their intern year. The part that I like to talk about for success, and I don't remember if I made a video last year. I don't know if you guys ended up.
I was going to say, you guys should watch it if you can go back. It definitely.
That's awesome. Yeah. And I shared, it's on my Instagram, and I shared it to the students from a couple of weeks ago. But I really think, and I don't even remember what's on it, to be honest. I think I ramble for probably quite a bit of it. For me, I remember it was Ed Chang. He's a surgeon at MD Anderson, and another one of my mentors, but they really focused on that reputation part. Do you guys want to talk a little bit about that, about what that means, your reputation as an intern, as the first couple of months when you're starting off, and how important that is?
Yeah, for sure. I remember after I matched to UW, Dr. Galvez reached out to me and was like, hey, we should talk, because he did his fellowship training here. And I found that to just be like a really helpful resource to figure out like what the program looks like, what I should be expecting. And that's something he told me, quite honestly. He was like, the first few months, you're going to be establishing your reputation within the institution, and that's going to carry and follow you through the rest of your training. And it felt a little bit intense at first, but it was very honest. And I saw that especially in seeing my seniors and working with the attendings that had worked with my seniors when they were interns, and how much that reputation had followed them. And knowing like, oh, I can trust this person, or I can confidently like agree with their plan. I live really close to the hospital.
There's more trauma at Harborview than at Cook County. Just kidding.
I don't know, man. That is tough.
I'm just kidding.
Homicides, apparently. So we're killing it, but oh god, bad words. No, I think it's really true. And so I spent a lot of the beginning of intern year, like focusing on my tasks, making sure they were completed, and staying true to my word. And I think that really opened up my team, especially within like the plastic surgery team, to really just trust me. And as I kept developing my skills as a doctor, it's to the point where I covered the burn ICU nights last week, and one of my threes looked at me and she was like, you're basically a 2. I trust you. Like, manage it all and then tell me in the morning how it went. Obviously call me if you need me, but this is really your opportunity to grow. And having that much trust was kind of scary. But I think it came from working really hard in the beginning and showing like, when I say I'm going to do something, it's going to happen. I'm going to follow through and make the efforts to make sure it's completed. So although it sounds kind of daunting when you hear it the first time, your reputation, including your attitude, follows you all throughout intern year. And I think that's the makings of a really great resident in terms of the way you approach things. Dr. Galvez said, this is a privilege, and it truly is. And sometimes I have to remind myself that like I get to be in this position, especially from where I came from, but thinking about the opportunity I have to affect not only my team, my patients, but also the rest of the staff that I work with. And I think that that has set me up to have really meaningful relationships with nursing, the patient techs, the janitorial staff here. And I feel really, really supported and welcomed in this environment now.
That is awesome.
I would say growing off of that is you not only are representing your own reputation, which is obviously important to set a good example of yourself and to put, you know, a good reputation out there about yourself, but you're also representing your program. And so on the opposite spectrum, I came into a program and a reputation that was not the best amongst our general surgery colleagues in particular, largely because some of my colleagues before me just didn't live up to expectations and did not leave a good reputation for our program. And so,
just to interrupt you there, that happens everywhere, right? So that's not even just at one institution versus the other. There is a high variability in the quality of the individual, and it's a complex answer. It's not just like ability to complete tasks and all that, but it's just lazy is probably the word. But that reputation of not really of caring, right? Of not taking the service seriously, right? Oh, I'm a plastic surgeon. I'm on the vascular service. I don't really care about this. I didn't do a Doppler or something. I don't know. Not that people say that directly, but it can show, you know, that you are not showing that you're trying to pretend. It's just like medical school. I think you're like, you just got to pretend. If you're on neurosurgery, you got to pretend that you're a neurosurgeon, at least for that period of time. Sorry to interrupt you. Go ahead.
No, but that was like 100% you hit it on the head, where like a combination of laziness and just people not caring enough, and our program being small where there's not really a mix of residents that can kind of balance out the reputation. Us being only one a year means you get one shot, set that reputation, and if not, like on to the next one. And so I felt a lot of pressure this year to be that person who either confirmed their, you know, previous thoughts about our program, being that, you know, we're lazy, we think we're better than the rest of the surgery department at Rush, and that, you know, we feel like we could be doing something more meaningful with our lives rather than being on said, you know, off service rotation. And so I, a lot of times, kind of started off my rotations on a bad mark because there was this already preconceived notion about what plastics residents typically act like and, you know, perform like. And 9 times out of 10, from what I've heard, I've gotten amazing feedback afterwards where people were like, you are going to go so far. You care so much about your patients. You developed skills that I've seen better than a 4th-year general surgery resident. Like I helped first assist on a sigmoid colectomy, like by myself. And the attending was like, yeah, just keep doing it. He let me do like 80% of it just because I had honed in those skills from my other rotations. And so, I was not too long ago the only resident on transplant nights. And we had a really sick patient in the ICU who I kept alive on multiple pressors and needed CVVH and all these things. And like multiple other services said like, oh, like you knew what you were doing. Like you were on top of it. I trusted you. There's other people on your service that I didn't trust. And you'll like see that while intern year is tough and you have a lot of, excuse my French, bitch work to do, and you'll feel like it's endless and you'll feel like you're just at the bottom of the totem pole and you're like clawing your way out of this cave to try to survive. There's those little things that if you just keep your head right on your shoulders and think back to either the advice we're giving you or the advice Dr. Galvez gives in his video, you're going to realize that, maybe 1 out of 10 times that you do something, you'll get positive feedback that you'll really take to heart and will boost you through the year and through residency. It's like those little like mushrooms that like Mario needed to get bigger and like grow, And, that's what's important about making sure you know, take time to reflect on yourself and maybe give other people positive feedback when you see it, because it really is kind of the juice that gets us going and makes us make it through. Because if we didn't have positive and negative feedback, then really we would be nowhere. There would be no
Awesome.
point.
Yeah, those are awesome points. It's those little, when you put your head down and you work hard, like you both are saying, I'm sure you guys are, and you guys are incredibly hard workers. It's those opportunities, just like you said, like those, like, the power ups where it brings new life of, this is why I'm doing this. This is like, you're doing it to be a good doctor, like you said, to take care of the patient fully, to become a surgeon, not for the pats on the back, right? It's for it's to feel like you are that doctor, right? And so what's interesting, and I don't remember if I mentioned this in the video as well, but this year essentially is determining what type of chief you're going to be, right? And I think that attitude is so important, because I've seen this before where the intern turns into an R2 and they're like, I don't do intern work. Like, I'm not doing that. And like, that's a mistake, because if you start treating people that way, right, you start treating everybody like that way for your entire residency. And then you're in this mindset of, I'm better than this person, right? And that ends up undermining things. You end up not having, you end up having interpersonal relationship issues, because you're treating people differently based on what their category is, right? And the reality is in your residency, right, you're going to be in small groups where you're going to have to do some of that intern, right? You're going to be rotating somewhere where you're going to be the intern, right? Or you're going to have a job where you don't have residents, right? And so you're still that person's doctor. And so if you think that those minor things are insignificant or not important, that's where patient care gets hurt, and that's where you stop, where that care, I think, really gets hurt. So those are really good points. And I like, for me right now, I take care of kids. I see really complex patients, and yeah, I have a nurse practitioner that I work with. I have a nurse that I work with full time to help to build and develop this program. But I am the intern sometimes, right? I have to go in on the weekends and round on the patient and put in the orders. It's the same Epic from 2011. It hasn't changed at all, by the way. There is no increase in technology in Epic. It's terrifying, because it's probably not going to change.
At least
but
it's
it's
Epic and not Power Chart.
What's that? Oh, do you have Power Chart? Yeah.
Yeah.
I'm so sorry.
It's still not, it's still clicking boxes. But what I mean is, you're still, many of those skills that you have and you've developed, you're going to be using the same skills 10 years from now. And so yeah, those are awesome points. And so we're on that aspect. Do you think there's a lot of topics within diversity, equity, and inclusion, and one of them is the dealing with microaggressions and things that that you face during the day, or you don't have to give me an exact specific example, but did you find, how did you deal with some of those things during your intern year, whether it's a conflict with, I don't want names or specific people, but where it was with specific staff or with specific colleagues that got you down initially? Obviously it hasn't gotten you down at this point, right? The way you both are telling your stories, it really is, it's awesome. It just, you guys are excelling. You're feeling, you guys have positive vibes, right? And you're going into your second year that way. That is amazing, right? And so keeping that up, and we'll talk about balance a little bit later, because you can't just be working all the time. But what are some of those challenges that you feel like you guys have had in the past year?
Yeah, I would say the first one was something you touched upon, which is the idea that a lot of my seniors have taken that idea that once you're not an intern, you never have to be an intern anymore. they really take it to heart. So there's a lot of things that they should be doing that gets signed onto me, that I would say is just a microaggression just based off of
That's a good
like
point.
rank
That's
level.
actually that's a really good point. Yeah.
And probably
dumb.
honestly, it's probably easier to give it to me because I'm a small little girl who has like a good attitude and is willing to say yes. I'm not gonna say no to them. So I just do it and I suck it up, but it's been a struggle because there's definitely things that, you have to set your limits and you have to protect yourself. And so there's only like so much that you should do. And there's some things that you really shouldn't do. And if you don't feel comfortable doing them or you think it's inappropriate, it's on you to stand up and say something, because if it goes wrong and you're the one who tries to do it or you're the one who takes care of it, guess who's going to be in trouble? You.
Yeah, that's a good point.
So that's been one thing I've had to deal with. Another thing has been the fact that I speak Spanish fluently, and especially at Cook County and just like all of Chicago I never, ever, ever expected Chicago to be as bilingual and as predominantly Hispanic as it is. And it's insane even at Rush, which is more of like our private hospital. We frequently have multiple Spanish speaking residents in clinic or on our service. At County,
there's a lot of Bad Bunny playing in the OR.
No, that's the thing, is there's no representation. I'm like the only Latina. But that's like a down the road in 20 years, hopefully there is more of us scrubbed into the ORs and controlling the music. But what happens is a lot of times, because I'm around, people will kind of be like, oh, Edie, come here. Like, I need you to
grab you, right?
And oh, Edie, like you need to, and today, like I had county clinic where we have 100 patients and they're like, oh, this guy's been waiting for 40 minutes. Edie, can you see him? Because he's only Spanish speaking. And I think that's a microaggression, because it's just because I'm there means that they don't have to go through the hoops that you're supposed to go through, which is getting an interpreter and setting up an interpreter. And that's like by law, like that is in the Affordable Care Act and in the healthcare legislature, that you need to have access to interpreting services. And they do have access, but because I'm there easy out. But then it can be stressful on me because I already am dealing with so many different patients. And from a personal level, a lot of times these patients, they're like, wow, you're the first person who's ever talked to me in Spanish. And they start asking me about all their other medical issues and their other medications that their other doctors have also neglected to use an interpreter with. And so multiply that by 80, because I would say probably 80 out of the 100 patients that we see in a day are Spanish speaking only.
Yeah, a large percentage.
It can be overwhelming, because if you're
stressing me out. Yeah.
if you're an honest and like have a high integrity for yourself as a physician, like you want to do what's best for each and every patient, and you want to take the time that's needed to take care of them as a whole. So that's the second microaggression. And then the third, just to be quick, is I'm tiny, I'm petite, I'm 5'3". I don't weigh very much. And so I think that a lot of times it's easy for people to look at me and maybe not take me seriously. And that's something that I've been working on, is kind of creating a reputation like we were talking about, where just because I'm little and petite doesn't mean I'm not confident in myself, don't know what I'm doing. Just because I look young doesn't mean I don't have experience to be able to give the appropriate recommendations and create an appropriate plan and operate on them appropriately, because I've actually had an insane amount of operative experience for my intern year. And it's gotten to the point where like these patients, you can tell like first introduction, they're kind of skeptical about who I am and I'm going to be their surgeon and who's like taking care of them. And by the end of their visit, they're like, wow, you're the best doctor I've ever talked to. You explained everything perfectly. You did the surgery amazingly. And so that's something that I saw from a few of the female surgeons, the female vascular surgeons at County, who are, like I like to say, badass women.
Yeah, confident.
And they're confident. They say what they want. You don't have to be rude about it. You don't have to be what they, that people talk about women being referred to as bitches, and like a guy would never be called that. You don't have to be that. You just have to be confident in what you do and own up to your mistakes if you make a mistake. But you just need to get your shit together and like present it that way, because it really does reflect on how willing a patient is to work with you, and kind of you are able to conquer those microaggressions just by developing that kind of an attitude, which I think is really important. So
Yeah.
I would say if you find any strong female surgery mentors, I would like actively search for them as soon as you start intern year, because I think that has been very helpful for me to see firsthand how other women who kind of are in my position handle that microaggression.
That is awesome. Really incredible advice. And it doesn't have to be from your program, right? It doesn't.
No, these are vascular surgeons,
yeah.
and like I love them. They're like my.
Don't switch to vascular though. Don't.
No,
switch to vascular.
God, no. Oh my gosh, I learned that the hard way. Never.
But that's awesome. Thank you for that.
I think those are all great points. Wow. I think to piggyback off of it.
I think you need to move your apartment, honestly.
But it's so nice to just walk to work. But no, I think that being Latina or Latino in medicine, you're constantly going to face microaggressions about your person being in spaces, and also like operating or navigating with other people. And that can come from faculty, that can come from residents, that can come from nursing, that can come from your patients. And at first, it is a little troubling. And I'd say my approach is to kind of choose the hills I die on. And sometimes I'll take it on the chin and move on, because I have other things I need to get to. And I don't want to disrupt certain relationships because I know I'll need them later. And that's something to be really cognizant about, is the reputation you're establishing for yourself now is going to follow you until you're a chief. And when you need that help from those individuals, like it's good to not burn some bridges. But there's definitely times that are very appropriate to stand up for yourself. And I've found that it comes a lot in just the way that people say things and the way that they interact. Being at UW, you get a lot of early like consult experience. So you do a full month of nights by yourself. And I think that was where I received most of my microaggressions, whether it was working with the ED critical care nurses downstairs who like literally thought I was some child lost there while I was like suturing up a bullet to the face, or the patients themselves.
I feel like doesn't make any sense. Like when they have an assumption, like, yeah, I'm just pulling out a bullet out of a mandible, no problem. Yeah.
Like,
I'm a volunteer here. Yeah.
It's a complex closure, like with a headlight and loops and everything, or even with like patients who are like, so when am I going to meet the surgeon? And I'm like, I am your surgeon. Like today and tonight, I am your surgeon, and this is what you're going to get. To patients asking, where are you from? Like, are you in the right country? Just little hits, and you just choose your battles and you move on. But definitely don't let it like knock you down, because you're worth so much more than that. And honestly, like seeing more representation, like Edie pointed out, like we don't have that much representation. I have one Latina female surgeon in the system that we have. And I hold her near and dear. But that's the problem, right? Like there's just one. Unfortunately, in the group of general surgery and all collective integrated programs, there's like 7 of us. So we're a small militia, and we just like want to see more. And I think reminding yourself of like, I'm going through some of these battles so that the person behind me doesn't have to face them anymore is a really good way to think about how you address microaggressions in the workspace. There's definitely appropriate times to just say it like blatant in front and say, what do you mean by that? Or what was your intention with that statement? I think that really like shuts people up when they say something that's a little racist or a little sexist. It's like, what was your intention with that statement? Because they have to justify the words they just put out into the space. And most of the time they can't. And then they say, well, I just meant, and you're like, I don't think that was appropriate. And you move on. Other times I'll just ignore it because I have other things I need to do. So also like finding your people, like find your people to vent with, find your people to cry with, find your people to just like yell out to the mountains, because you're going to feel a lot of emotions intern year, and they're all very valid. No one like gets out of this like with a level head, or at least having one day where they're like, can it just end? But having people that you can call up or talk to and say like, wow, like I got worked yesterday, and they can tell you like, I've had a similar experience, or like these are my hardships. And I think that just kind of helped me figure out like, okay, this is how I'm going to approach the next few weeks coming onward.
That's awesome. Yeah. So those, just like you both mentioned, it's this balance of there's gonna be microaggressions, and you just mentioned multiple ways. And it's just like you mentioned, it's picking your battles, and it's valid. And I like your approach, and I've heard that approach too of taking it head on, right? I think that's awesome, but it's you have to it's a balance. You can't, if you are someone who's going to take on categorize everything as a microaggression, you're going to stop at some point, right? And so you're taking care of patients, just like you guys said, that you have to move forward and address some of them head on for sure. But you also, just like with it's another category, right? You can get bogged down in multiple areas in intern year. That's why it's this balance. It's a dance, right? Of what you take on. And so I think that approach that you guys both mentioned really, really makes a lot of sense. There was something else I was going to mention. I think that's it. So, are there any other challenges that, or any other recommendations that you guys have for is there like with the interns that you guys are going to be training the new interns, right? In a week or something like that, right? What are some of those other recommendations that you would say into some of the students that are coming in next year?
One of my fourth year seniors who like got me on my very first service, I was fortunate enough to start on plastics, which was like very shocking because it's a lot of work, but also super fun, and I was really excited. He told me there are two kinds of interns, one that writes everything down and the second one that forgets. And that like really stuck with me, and I wrote everything down because if I don't, I will forget it. And so like when you were mentioning the check boxes, Dr. Galvez, like it's very true. And I literally told Ryan this, like a multicolored pen is your best friend. Keep one on you. It's like stay strapped, because you can manage so many more patients and so many like heavy loaded services or acute patients by just having a color coded system.
Yeah.
And finding a way, like obviously you're not going to just like show up and have your system perfected your first day, and your system's going to change depending on the service that you're on. But I found it to be kind of like my grounding place to know that these were the tasks that need to get done. These are the ones I've gotten done, and these are the ones that need to be done by the afternoon. And that way, when your senior kind of comes back and says, you know, they were in a big case doing a deep, and they're like, hey, did this person do this? Or did this person get this? Or did this consult service see this patient? You can say, yeah, these things were checked off, and I wrote down what the consult service said, and this is what it is. And that kind of just again helps establish that reputation of like, your senior knows that they can disappear and that the service will continue to run without them having to kind of hover and make sure that things are flowing. Rely on your team. Like if it's totally okay intern year to not know something, and I learned that the hard way of like, I wanted people to think that I could just catch on really fast and know things and I could nod along. But then it got uncomfortable because if you're asking something at a later point of the rotation, it's like, well, how did you not know that day one or day three or day five? So it made me kind of shift my mentality of like, it's okay to not know things on a service. And I'd rather ask my questions early and soon so I can pick these things up than week 2 or 3, when I probably should have asked these week 1. And I even tell that to medical students, like we tell them, like, we don't expect you to know everything and anything under the sun, but I'd rather you ask all the questions up front that you can think of. No one's going to judge you for them. And that way, by week 3, week 4, you're going to start to feel some comfort with either the vocabulary or the procedures or the patient population that we're treating.
Yeah, I would echo on top of like not being afraid to ask if you don't know something. I would say you also shouldn't be afraid to ask if you need help with something. So there's a saying, intern year, you'll probably hear called load the boat, which is like, if you feel like you have hit your max capacity for like what an intern can handle, like as soon as you like get even like an itch that like this might be beyond something that you can control, you need to ask for help immediately. And like same thing as asking questions, like people will not get angry at you for asking for help. Like it's known that you don't know everything, you don't know how to handle everything. And sometimes there's stuff that just one person can't not simply handle on their own. It takes more than one person. So like examples I can give of that is that there's time, like I said, my intern year was very surgery heavy. I have already logged like 170 procedures, which is insane. And that's just a product of the fact that we have a very small program and we're like drowning in the amount of like workload and caseloads that we have for the size of our program. I'm currently the chief turn at county, which is crazy to think that I am like the chief resident for plastics at Cook County Hospital right now. And I was that month 3 of residency. So like, who knows where you guys will be in your respective programs and like what will be expected of you. But there was a case that I was in that I was left alone to like finish it up. It was a complex case with 3 different other services for an oncological lower extremity sarcoma resection. And so we did the final closing flap. Vascular had done a graft for their popliteal artery. And I had been checking Dopplers, got her on the bed, got her to PACU, and I couldn't get the Dopplers anymore. And, Doppler signals are not easy to find, especially your intern year. You're like, I think I hear it. Like there's a little bit of something there. And so I personally, thought, maybe I'm doing this wrong. Who knows? But I can't find them. So I'm going to call for help. So I paged Vascular immediately. Vascular came. Turns out they couldn't find them either. So the patient ended up going back emergently to the OR. And so that was like me by myself handling getting this patient back to the OR, calling my attending who was already scrubbed into another complex flap case, being like, hey, by the way, we're going to have to go back. I like am willing to scrub in and show them like what reconstruction we did and how to get to the graft and what else do you want me to do? And because I called early and asked for help, we were able to immediately get this patient back to the OR. But had I, maybe been like, oh, well, you know what, maybe I just like am missing it, or I think I hear it, maybe it'll, get better and like give it some time, that easily could have ended up costing that lady her limb. And there's other stories I have where patients like looked horrible and vital signs were fine. I didn't like the way they looked. I called my senior. Within 10 minutes, they coded and they're still alive to this day. And so, when you call your senior and they're like, their vitals are fine, but they look horrible. Can you just take a look and just make sure I'm not crazy? You doubt yourself for sure when you're like, hey, can you double check this? But you never know when it's going to be that time where thank God you did ask for help.
Yeah. And especially when you're at that point where you have to make interventions, right? And you just don't want the appearance, right, that you've gone rogue, right? That's another thing, right? You want to make sure that, like you said, load the boat, that everyone agrees that this is, obviously sometimes it's emergent, like you just did with the vascular checks, that, that's gone. You have to report that immediately, but you have to get everyone on board, like you guys said.
Yeah.
So,
that's honestly huge. And like one way that my senior faced it on nights, because obviously like you don't want to be the intern calling your senior for every little thing, but like it's a growing experience and obviously you'll get better at it the more you do it. And she told me like, I will never be mad if you call me just because you have a question or you're not sure or something feels wrong. Like I can come in and help you. What I will be mad is if something happens and something's done and I'm not informed. Like I wake up and then I find out. And it's not to like pin it on the junior resident, but it's because like obviously they want to help. This is their responsibility too, and they want to be able to like work through that process with you. And I found that to be so incredibly helpful when I was like, it's 3 a.m. and you're doing a reduction and you just like feel something's weird or you're not really sure yet. and you can call ortho and have the R2 come by and help you out because they're great and they've always been there to help us when we need it. Or you're doing a revision amp by yourself and you can't control like hemostasis and you need to call your senior. And I think that it feels weird to ask for help, and it almost feels like you've like done something wrong or you're not getting it right. But I've never been in an experience where a senior from any service anywhere has ever shamed a junior for asking for help.
That's great. I think we're approaching the end. For me, I think I mentioned the video too, like my plastics rotation was the hardest for me. It may be different for you guys. And the reason why, it's just you respect your program, you want to perform well. But like you said, sometimes you can overextend yourself, right? And so that's one thing that I always found surprising, because you're like, you go into plastic surgery to do complex reconstruction and learn all these different things. But when you're on the plastics rotation, you're just trying to make that service the most efficient thing that you have ever seen, right? So that it's patients are discharged on time and things are followed up on, and while managing the expectations that you're going to be scrubbing into cases, right? But the work has to get done, and I think that's that I think is the another point, that the work has to get done and someone has to do it. So it's a balance of those things. Any comments about balance in your intern year? For me, it was, I'll make mine quick. Mine was just, it was really like the work hard, play hard year for me, more so than the other years, because I felt like you have like pretty good protected weekends, at least for me. And so, I would do everything to try to get away from the hospital. But what are some of the things that you guys did to maintain balance during your year?
Yeah, I mean, I think it's important to keep your hobbies. I think you got to put it into perspective. So if you had maybe 3 or 4 hobbies before in med school, you probably will only have time for one. So try to kind of maximize which one will make you the happiest and how you can schedule that one. So for me, that is yoga. I like love yoga. And so even though like the yoga studios usually only offer classes like 6 a.m. to 6 p.m., which is really not possible with our schedule, especially intern year. I would try to go as often on the weekends as I can, or sometimes there's like virtual classes now. So if I really was feeling ambitious or really needed like to take a break mentally, I would go and like do a virtual class in my apartment. I have a dog, so it really helps, because as much as it can add definitely a significant amount of stress, and especially if you don't have someone else to help you out with it. I know having a pet seems impossible in residency, but thankfully I have my boyfriend, and I love him so much, and he helps me like at least get out of the house whenever I do have free time, and kind of get more activity out of me than I probably would if I just like came home and laid on the couch and watched TV, which is also like a valid hobby. Like Netflix binging can definitely be an outlet for residency.
Therapeutic.
Yeah.
My wellness as a fellow at the University of Washington was getting ice cream. That was my wellness at the Harbor View cafeteria.
Oh yeah. Team ice cream. Anytime we have a late flap, our attendings treat us to ice cream, and it's so nice, and it's like really good. It's like good ice cream, so it's very exciting. I think for me, I take like just some wins in the little things, and so that's kind of what has been my wellness throughout this. Like I love driving. I don't know why, it makes me feel free.
I like driving too. Yeah.
Take care of my car. Like I named her Pearl, Perla. She's a baddie in the streets. And I take her to get a car wash. And like that for me is like a win. Like I feel like a real human doing real things. I love to go grocery shopping, even though it takes up my time. I like to feel like just like a normal human for one day and like do generic tasks. I love to cook. So I try to make myself dinner every night. I still have a stash of Trader Joe's frozen food just in case like it's been a rough day. But to me, like all of those things add up. It's hard, like Edie mentioned, like your hours are rough intern year because you're expected to stay and hold the pager, and that will obviously change the more senior you become, thank God, and you get a lot more weekends. But for what we have now, like just spending some time outside, cooking a good meal, going on a walk, like has met my needs. And then just relying on my family and my friends, even though most of them are on the East Coast, they've been incredibly supportive, and I'm really appreciative of that.
That's awesome. I think that's it. I think we've used up the hour. I guess if there's any questions from the group, I forgot to ask that earlier. Is there a chat? Yeah. If anyone has any questions, feel free to insert it on the chat, or you can actually just join us too.
We don't bite.
Yeah. But
yeah, I would say one other thing on top of like writing everything down on your list is like, make sure you take time to like reflect and write things like maybe in like a notes on your iPhone or something, like whether it's attending preferences, whether it's like the surgery that you saw, whether it's some cool case that you did, or maybe like prepping like a quick 5-minute review of like with anatomy and stuff that you can refer to in the future next time you do a distal radius fracture repair or something like that. Like that has been super helpful for me because the attendings, like back to the reputation thing, when I come in and I'm like, oh, you like using 4-Vicryl and 3-4-prolines on the skin with like a rescue stitch, they're like, oh, you remember.
That's their love language. That's why.
Yeah. So that will give you like extra gold stars as an intern.
Mm-hmm. I think that OneNote is a really good option, and then like Evernote I think is the other option that I feel like is really good to transfer from like cell phone to iPad to laptop. And you can like update it with like didactics teaching, but also like self-studying. I've gotten to the point where I just literally copy and paste every single one of my attendings operative notes for the cases that I feel like are very consistent. And I'm hoping like our 2-year will be the year where I like really fine tune like with a just like a detailed run through to the point where I can feel really confident when I'm a 3 and a 4, like being like, this person operates this way. And I think that seeing that in my seniors has kind of motivated to do that myself. There's a lot of really good resources for studying and tools. I think keeping it simple intern year was probably the best move because there's a lot of resources you can kind of reach out to. One really good advice I got was like the Buck Green resource for like in-service studying. And I found that to be like a really good format of like how to simply break things down. And it has really great Netter's diagrams and like hits all of the really big topics. There's Anki flashcards that other people have made that you can find on Reddit that some people use and find really resourceful. When I was on hand nights and craniofacial nights, I referred to like the craniofacial trauma book that's written by most of the Duke attendings, as well as the Michigan manual. And I found that to be like a good way to be like, oh, this patient has this. And I would just like flip through the pages and just read through that. Or even like ortho bullets. Ortho bullets is genius for hand, like hand trauma, hand management, quick, like if you just want to look at your options to see what you can offer for your senior, it's a really good resource. It's free, it's public. All you need is your phone. So finding ways to keep resources not only at home, but actually on you in person when you're navigating the hospital is really helpful.
And that's a skill. It's things that I look up things all the time, right? Review anatomy right before there's some people that are going to be geniuses within your residency with photographic memory and, but you don't need to compare yourselves to that. You'll be just fine with preparing and reading and reviewing before. It's just kind of your thought process to make things, and it's safety. It's like you're being safe by reviewing things before the case. Do you have a question, Giancarlo?
Yeah. Hi, everyone.
Can you introduce yourself and
Yes.
kind of where you're at in training too? Thanks,
yeah,
man.
It's a pleasure meeting you. It's my first time actually being involved in the community. I just found out about the Instagram page like around a week ago. So it's a pleasure meeting you all. Thank you for doing this. I'm actually a medical student between my 2nd and 3rd year. I'm from Puerto Rico. I'm on UCC School of Medicine. Currently, I'm doing a research fellowship at Yale School of Medicine. I'm finishing actually late July. My question was basically that what are some of the skills that you thought basically that you needed that, or that after you passed through your experiences that you think students should have when they go to their sub-Is at their fourth year and as a first year residents? What are some of the like things that you would say you definitely need to have this down before you go into those part of your like career?
Good attitude. I honestly think like it makes a difference if you show up and you're like willing to help and you're eager, and like Thais was saying, like we don't expect you to know everything. You should know like what you think you should know, which is, you know, the basics about the patient, what the procedure is going to be, maybe a little bit about the anatomy and a little bit about how to do the surgery. And you know, the PRS, what's the thing that Abra does? The PSRCV.
Oh yeah, PS
I
virtual.
Let's
I
not have
don't
her
know.
see this
It's like
a segment of the video clip.
the plastic surgery virtual curriculum of some sort, the Abra Shen. We can put a link. Yes,
Yeah, the
there it is.
PRS VC.
Look that up. I don't know how often they do like the actual like in-depth like what are they like kind of
Yeah.
more high yield like review sessions and stuff, but the way that she broke down like how to review everything and go through the chapters, I think is incredible. If you can get through that before you are on a sub-I, then you'll be golden. Even if you retain like 50% of it, you'll probably know more than most interns even. So I think that if you just show you're passionate, that you put in the time and the effort, and that you're like excited and eager to be there, and like you're there for the right reasons, like you should be extremely successful.
Thank you very much.
Yeah, that's great advice.
Skilled.
I was my smartest as an MS4 on my sub-Is, on my last sub-I. And then all that stuff, you know, came out of my brain. And by the time I was, you know, on my intern rotation, like it had hemorrhaged already. So
I think a skill that is like super important to hone in medical school, and that every good intern should have, is how to present. And I didn't realize how important that was until I hit intern year, and attendings were like, wow, that was like a really good presentation. And it's because you can break down a super complex patient and present them, or a very simple like elective procedure patient, this is what they want. But your ability to take in that information, like just narrow it down to exactly what they want to hear in like a very succinct, time efficient way, and then to give that back, is super important in medicine. And when you start to give good presentations, attendings will listen to you more. They'll block out the rest of the world, and it's insane that they do it, but they will, and they'll listen. And then they'll want to hear your plan. Like they'll want to hear what you have to say next, which I think is sometimes hard because everyone's so busy. So I think just exercising that as much as you can, like having a system, having a flow. I remember being a medical student and writing out every single presentation at first, because that was the only way I could feel comfortable than just saying it. And then slowly then transitioning to bullet points, to then just running off from my head. And I think that once you're an intern and you can do that, people will listen, especially in ICU settings.
really great advice.
Thank you.
Ryan, do you have a question, man?
Yeah, I'm curious. What do you think the hardest part of the transition from med school to intern year was? And do you have any tips for how to overcome it?
And Ryan is at UCSF, and he's going to be joining UW this coming in a week.
Yeah.
I would say putting in orders was like a rude awakening, because for some reason they don't have students practice this. I practiced it on 2 or 3 med student rotations, just because like there was a resident that was willing to let me co-sign orders to them, which just adds an extra step for them. But I don't really know how you can practice putting in orders.
They don't usually allow, there's no great way to do that. In the past, when you had a paper chart, which I had paper chart for part of my medical school, it was actually med students could be much more involved, because you could pre-write them out and then you just hand it to somebody and they would sign it. And so you would learn how to do the orders because you would write it down on paper essentially. So that was for our county rotation. But we talked about orders too, right? the rules of orders. I think I put that in the video too, just like how you can put the order in. You can't like trust anybody because you put the order in, you think you put the order in, but somebody paged you, right? And so you left the order open and somebody closed it out, right? Or you put the order in and the patient gets transferred and it gets lost. Like there are many ways, or you thought you put the order in, but you checked the box and you didn't fully go through with it. But there's so many ways to make errors. It's just and that's the problem with medicine, right? There are human errors that happen. And so I really think it's good to just double, like if it's an important order, like an NPO order, it's like, right, that could make a big difference for a patient, family, the team. I think it's important to double check it. I don't know. What do you guys think about that?
No, I think that's huge. And I think that's kind of a transition. Like one of the first experiences I got at Harborview, I was shadowing an intern because that's what you'll do for your first day, Ryan. You'll like follow someone that you're the service you're coming on to. And I just asked them, I was like, hey, like, what's your best piece of advice for me coming on and like about to tackle this year? And they looked at me and they said, trust no one. And that's not to say that like someone's going, like it's not in a bad way. It's just like at the end of the day, it is your responsibility and that you need to really own that, especially when you're like on nights on any service and someone's like, oh, like, yeah, like they've been consented, their MPO, like COVID, unless you've seen the COVID result, unless you saw the MPO order and confirm with nursing, and unless you physically saw the consent with your eyeballs, and it's in the chart and you've probably taken a picture and uploaded it to media just in case they lose that paper chart, none of those things are true. And it's not just because like you don't trust people, but it's because you don't want to delay care for other patients. Like imagining not checking an MPO order, seeing the patient had breakfast and then ruining an entire schedule sucks. And that's like one of my bigger fears when I was on nights. And so I didn't trust anything until I saw it or I did it with my own hands and eyes. Yeah, I think that's a really big point for intern year.
I think you should wrap up to respect both of your guys' time. But thank you so much. I think this was incredibly valuable. We've recorded the session. And the hope is that we can share this with some of the other, some of the incoming interns. So I really appreciate both of your time and expertise. And I wish you guys the best of luck. I'm here. You guys have my number. You guys can text me. Everybody who else is watching, you can reach out through social media. But it's I'm being serious. I'm here, right? So if you guys ever have any questions or you come across something you want some advice on, I'm happy to help in any way. I know you guys have mentors there. And so, yeah, good luck. It's going to be fun. R2 is good. It's good.
Do it.
We'll see.
Yeah.
Okay.
All right. See you guys later. Have a good evening.
Bye.
Bye.
Bye. Thank you, everybody.